So now let's jump to the employer mandate, which is really what you all want to know about. When I am talking about the employer mandate, I am talking about large employers. And the large employers are defined as 50 or more full-time equivalent employees. So if you are a large employer, the law says that come January 1 of 2014, you are supposed to provide coverage to all of your full-time employees. And you're supposed to provide coverage that meets minimum essential requirements and is affordable to the employee. So let's look at what that looks like. The first thing you want to do is you want to figure out if you are a large employer. So 50 or more full-time equivalent, what does that mean? Okay, if you are clearly a small employer, you've got 11 employees, you're a small employer, I'm not talking about you for basically the next 10 slides or so. But you can check your email if you want, but you should pay attention in that you want to know kind of where the market and the industry is going. But I am talking about large employers. If you're 150 employees, you clearly know you're over 50, so you are a large employer. But let's say you're like restaurants, you're a restaurant chain, you've got 3 little restaurants, and so you've got about 20 full-time managers, and then you've got about 60 part-time servers, cooks, that sort of thing. What does full-time equivalent mean? So what they're saying is what you do is you take all of your full-time employees, and full-time becomes 30 or more hours a week. So everybody that works 30 or more hours a week, you count them as one, so you don't have to count their individual hours. Then you take all of your part-timers, you add them all together and divide by 120, and that's how many full-time equivalents. So when you take those 60 waiters and waitresses in the front of the house and you divide all their hours, or you add them all up, divide by 120, and it comes out to 25. We've got 20 full-time people, you got 25 part-time people, you have less than 50 full-time equivalent. You don't have to comply for the upcoming year because they're doing this on a calendar year basis. But if you add up all those part-timers, divide by 120, and it comes out to 35, well, now your 35 plus your 20 is over 50. So you are considered a large employer. Now, you can exclude seasonal employees if they're truly seasonal. So let's say one of your restaurants is in the mall at Christmas time and you totally ramp up for 2.5 months over November, December, middle of January, and then you let everybody go. They are seasonal employees. They work for you for less than 120 days. But you can't just exclude everyone that doesn't make it 120 days. They have to really, really be seasonal to be excluded. You can also exclude leased employees. So anybody that is a temp through a temp agency, they wouldn't need to be counted as part of your count. And right now I'm just talking about counting. Eligibility is on another slide. So we're just figuring out how big you are. So if they're leased through a temp agency, they don't count. Owners, partners, that sort of thing, if they don't work and take a salary for working, they also wouldn't be counted. But a controlled group is counted as one employer. So let's say you said, well, forget it. I'll do 3 different tax ID numbers for my 3 different restaurants and I will avoid it. No, if you are a control group, you're basically in a very high level. If you have 80% ownership of each entity, they are all considered one. So this is governed under Section 414 of the tax code. Definitely have a tax advisor tell you whether or not you're a control group, not your benefits broker. But if you are a control group, you're counted as one employer. So you would add up your 3 restaurants to count as one. And you must use a reasonable expectation standard. So I'm saying we're going to do this calculation on an annual basis. Right now, how they said to do it was that you would look at 6 consecutive months. So let's say it's March, April, May, June, July, August. You would do the math on each month separately. So you'd look at all the hours in each month. You don't want to combine them all together because then if you were much higher one month, that would kind of mess with the curve. And then you would look at, of those 6 months, on average, are we averaging over 50 employees? And then you would do this on kind of a calendar year basis. Now let's say though that you're hotlittle.com and you've got 12 employees now and you just got 36 million in funding and you're ramping up like crazy, so you reasonably expect to be 50 employees next year, then you should consider yourself a large employer. The IRS uses the reasonable expectation standard actually in quotes all over the place in this stuff. So if you expect to be over 50, then you would consider yourself a large employer. So this is for the purposes of counting whether or not this applies to you. So if you're under 50, you don't really have to meet these mandates, but understand that your competition does, and this is what other employers are going to do, and so that may affect how you want to think about this. Interns. So interns are part of the counting process of how many hours are going to be worked. Unless, okay, if you just have some interns that come in and they're actually doing work, I would say you would count them. But let's say you have a big intern program and it's basically seasonal. You have a formal where you get a bunch of them in here and it goes and they work less than say 90 days, and because I'm going to talk about eligibility, then you may be able to say this is a seasonal program and not count them. But that would, you really need to be able to formalize why that's a seasonal program. So you need to be able to defend it. So this is figuring out if you are a large employer. So then that kind of jumps us to the employer delay. Okay, so this was interesting. The mandate itself that you provide benefits come January 1 of 2014 in itself was not delayed. What was delayed was the reporting that was going to need to be done. And again, in my opinion, it's because the IRS is not ready. So what they have said is you don't have to do any reporting on this year. So in practice, the overall mandate becomes delayed because no one is going to check up on you, but they're hoping for voluntary cooperation. So we'll see how that goes. I'm not sure what kind of rate of return they're going to get on that. So basically, information reporting for 2014 has been delayed and no penalties will be applied to large employers for 2014. There won't be any employer shared responsibility reporting, but again, everything will be fully effective come 2015. So that is a little bit interesting when I start talking about things like the effective date, because in all these little regulations, they use dates that were effective in 2012 and 2013. So one might assume that all of those dates are going to get bumped up a year, but that isn't really what they said. So for the time being, I'm going to say, okay, you don't really have to do this till January 1 of 2015, but when we're figuring out the math on this, I'm going to stick with the original dates unless they tell you differently. So what I mean by that is, so basically this law, if you're a large employer, this now becomes effective January 1 of 2015. You are required to provide this plan, this reasonable plan that is affordable, come January 1 of 2015. But there is some transitional relief for employers that have what they call fiscal year plans. So if you're on a January 1 plan, this kicks in for you January 1 of 2015. But if you are on a fiscal year plan already, meaning you have a May 1 renewal, a July 1, a December 1 renewal, you actually are not going to have to meet the employer mandates until your renewal after January 1 of 2015. So that is if you meet these 4 bullets I have below. So one, you must have had a plan in place on December 27th of 2012. So until they tell us to do the dates differently, I'm still going to go with that 2012 date. So you must have already had that fiscal year plan in place. You can't decide to do it now to avoid this for 6 months. You had to already have this in place. And by the way, the regs were published on December 28th. That's how they came up with that date. So you had to already have that in place. At that time, you must have offered coverage to at least 1/3 of your employees or had at least 1/4 of your employees. Now, most of you will probably already meet that, but we have some groups, this is a big deal for some of our restaurants, hospitality, growers, that sort of thing that have a lot of employees that don't have coverage. If you didn't meet those dates, you're going to have to be compliant as of January 1 of 2015 if you don't meet those numbers. And at that time, all full-time eligible employees are offered qualifying coverage on that renewal date. So if you had a plan in place on December 27th of 2012 that was on a fiscal year plan and at least 1/4 of your employees were enrolled, and it's your employees, it's not even full-time employees, 1/4 of your employees are enrolled or 1/3 were eligible, you don't have to comply until your renewal date in 2015. So that is your effective date now come 2015. All right, then I mentioned that you have to have a plan that provides minimum value. So basically you have to meet that 60% threshold. The good news is the vast majority of large group plans already meet this. And you're not going to have the big disruption in underwriting that the small group market has. I mean, not a lot is really changing in the large group per insurance carriers. It's mostly now on employers. So the vast majority already meet this standard. If you are concerned, there is a minimum value federal calculator online. I can't figure out how to use it, but your general sense is if you have a funky plan with a really high deductible, that plan is probably going to go away. the insurance company just isn't going to offer it anymore. So it needs to meet that 60%. They did put out some minimum value safe harbors. Basically, they said you could have a plan with an up to a $3,500 integrated deductible with an 80% cost sharing and a $6,000 out-of-pocket max. That would be a safe plan. So if you have a plan with, say, a $3,000 deductible, that one's okay. But if it has a $5,000 deductible, it's probably not meeting the standard. Now, you could get yourself an actuary to figure all of that out, but probably, you know, we're not going to bother. You're just going to go with the offerings that the insurance companies give you. Though if you are a self-insured employer, so self-insured employers, you are going to have to be able to certify that your plan meets the minimum value. So probably whether your TPA will do this or we'll hire an outside actuary, self-insured employers are going to. But if you are fully insured, you can pretty much in California be assured that the California's insurers are going to make sure that you have a plan that meets those qualifications. You could also have up to a $4,500 integrated medical and drug deductible with a 70% cost sharing if you put money into an HSA, $500 of first dollar coverage. So HSAs are still very much part of the mix. What you have to do then is make it affordable. Okay, so the affordability clause says that as a large employer, to have a plan be affordable, it must not cost more than 9.5% of an employee's income, box 1 on their W-2, for coverage for single coverage for the lowest qualifying plan. You also must offer dependent coverage, but you don't have to pay anything for it. So you just have to make it affordable to the employee, and you need to offer dependent coverage. So there's a couple different ways you can do this. You can do this on what they actually worked. You can say, okay, if I have a $10 an hour employee and they work 40 hours a week, what's 9.5% of that? But the problem with that is you're going to have to monitor it. You're going to have to make sure if they work under 40 hours a week, because full-time now is going to be considered 30 hours a week, that it still is considered affordable. So there's a safe harbor where they've said, hey, if you just do it based on 130 hours a month, which is basically 30 hours a week, and you take that calculation, you say, okay, if you make $10 an hour, you work 130 hours a month, what's 9.5% of that, and you set your rate at that, which by the way is about $124, would be the minimum for someone who makes minimum wage in San Jose now, which is now $10 an hour. You must offer a plan that meets that 60% threshold and doesn't cost the employee more than $124 for single coverage. So that's where a lot of the base plan kind of concept comes in too. So what you could do is you could find the lowest, cheapest base plan, charge the employee the lowest amount that you think it's going to take to get them enrolled, but then have better options. And if they choose to buy up and it goes more than 9.5%, that's not your problem. You offer a base plan. So there's a couple different ways that you can do the calculations. You can also do it on the federal poverty level, but that's all based on $8 an hour as a minimum wage, which isn't even the minimum wage here in California. So this would be, when you do your renewal this year, it would probably be worth the exercise when you're putting together your census for your broker to have hourly wages in there if you have lower income employees, and kind of redline it. Figure out, is this not affordable for anyone? You don't have to meet the mandate this year, but you should know if it's going to be very problematic to kind of have an idea a year ahead that you're going to have to either change your contributions, change your plan offering, something. Otherwise, you're going to be looking at the penalty. All right, with that, you can implement wellness rewards. So you can offer rewards of up to 30% of the cost of coverage for wellness rewards. However, when you're figuring out affordability, you actually have, the law is making you assume that everyone doesn't meet it to meet that affordability. So basically, you'd have to have that $124 as the rate, and then they could actually save another 30%. So you have to include the fact that they may not make it on the wellness rewards in your affordability. But if you want to do rewards on smoking cessation, which you are allowed to do, even though the carriers are not allowed to change rates based on smoking, you as an employer can put smoking cessation in as part of your rewards program and differentiate the rates. You can assume that everyone is a non-smoker for the purposes of affordability. So if you have smokers and you want to go here with your contributions, you can actually charge them more, and you don't need to meet that 9.5%. Now, this is something that we do for some of our groups that are really into wellness, and they put some resources into it. I wouldn't just slap this on your benefit brochure and say I'm going to charge my smokers 30% more without giving them some options and having a program in place. I mean, you can, but it's probably a pretty negative employee relations move. So eligibility, like I said, counting is different than eligibility. So now we're talking about you're a large employer, you figured that out, you have to offer a qualifying plan. Who is eligible for it? Okay, under this law, come now January 1 of 2015, anyone who works 30 or more hours per week is eligible for medical insurance. So you need to change your policy to allow anybody that works 30 or more hours a week. This is just for medical insurance. So you could have different eligibility for your vacation, PTO, your dental, your 401k. That is entirely up to you. But that will be one of kind of the strategic things that you want to think about this year is for administrative purposes, is it easier to just move everything to 30 hours, or do you want to kind of keep those things separate? You must have a reasonable calculation method for those whose hours aren't counted, like your sales, your full-time commission-only salespeople, that sort of thing. Have kind of a policy about that. But if you hired them and you know that you hired them to work full-time, and full-time is 30 or more hours, they must be eligible for your medical plan now within 60 calendar days. So on a federal level, it's 90, but in California, it's 60 calendar days. So this is for your employees that you know you hired them as full-time, as 30 or more hours a week. There's also a safe harbor in there for variable hour employees. These are your employees that you hire, but you don't really know how many hours they're going to work. So let's say, back to my restaurant example, your servers. You hire all your servers and you schedule them for the first time for 20 hours a week, but you know if they're any good, their hours start creeping up. At what point do they become a full-time employee? What they've done is they've said, using our safe harbor, you can have a measurement period of anywhere from 3 to 12 consecutive calendar months. So you decide what works for you, but you set your calculation period, your measurement period. It has to be the same across the board. You can't have for different people, but you would decide, hey, I'm going to look back either the last 3 months and see if they've averaged over 30 hours. I might go with the last 6 months. But once they meet that 30-hour qualification during your measurement period, you now must have a stability period of at least 6 months. Equal to your measurement period, but at least 6 months. So basically, if you hit their 6-month anniversary, you run a report of their payroll records, see whether or not they averaged over 30 hours a week. If they didn't, you don't need to worry about them now for another 6 months. But if they did, you now need to make them eligible for your benefit plan, and they must be allowed to stay on it for at least 6 months, whether or not they continue to average over 30 hours a week. Now, if they're not your employee anymore, if they're terminated or laid off, they would still be put on COBRA. But if they're working 2 hours a week, they would be eligible for your health plan. So this can get really complicated, and this probably doesn't apply to at least half of you, but if you have variable hour employees, this year with your handbook update that we'll probably do in the spring, this would be the time to think through this policy. Let's not wait till next December to look at this. So school employees, they have laid out a specific guideline for school employees. So if you are a school, you look at the hours that they worked when your school was open. So when they were available to work. So if you have them on a 10-month year, you wouldn't look at the 2 months that they're off in the summer because the school's not open. You would look at the hours that they worked. Same thing with like a plant closure or something. Like if you close down for 2 weeks at Christmas, that doesn't count as zero towards those people. You just don't count that time period. The other exception might be if they are on a protected leave. So let's say someone was on FMLA leave of the 3 of the last 6 months. You just don't count those 3 months when they were off. You would only average out the hours that they worked when they were working for you. But let's say they take a personal leave. It's not jury duty, it's not FMLA, it's not pregnancy disability leave. Those weeks would count as 0. So if you have employees, you don't really call them seasonal, but they kind of come and go, a month here and a month there, that time would count as 0. So I could do, this is a couple-hour discussion with any of you that have a lot of that, so I'm not going to go into the scenario, but this is one of those things you want to start thinking about now because it affects your workflow. You can't just decide, and I know there's been a lot of press about this, some of these big restaurant chains have come out and said, oh, well, we're just going to make everybody work, 28 hours. Well, maybe that works for you and maybe that doesn't because that's very disruptive to your workflow. And so all through this process, as I talk about these mandates, you're going to be comparing the cost of turnover to the cost of benefits. And so start thinking about some of these discussion points now. All right, so let's say you say, forget it. I want nothing to do with this. I hate this law. I don't want to provide benefits. What are your penalties? Okay, so the penalties are if you fail to provide coverage for all of your employees. They do define all as 95%, but that's really for administrative errors, so I wouldn't aim for 95%. I would go for 100%. But if you fail to provide coverage for 100% or 95% of your employees, your penalty is going to be an annual payment of $2,000 times the number of full-time employees minus 30. So let's say you're 60 employees and you do the math on this and you say, hey, 60 minus 30 times 2,000, well, that's a $60,000 penalty. That's cheaper than 1 month's premium. That's a good deal for me. I'm going to take that. I'm just going to pay the penalty. But you know, if you're like 160 employees and you minus 30, now you've got 130 times, I mean, you're taking a $260,000 penalty for nothing. Here's the other thing, these penalties are not a tax write-off. So your health insurance premium that you pay, you take off somewhere around 44% in taxes on a state and a federal level. There's no tax deduction on a penalty. So you're really paying this for nothing. So the idea of pay or play, it was in the news for a while, and these big employers said, oh, we're going to drop all of our coverage. In our client base, we haven't seen that at all. Every time I do an Excel spreadsheet, I can find you a cheaper base plan that qualifies that's going to be cheaper than you paying the penalty. And clearly, you know, paying the penalty versus providing insurance coverage is not going to be a good employee relations move. So that's what you're going to think about. Now, let's say you offer benefits to all of your people, but a bunch of them don't take it. If they don't take it, but it meets that 9.5%, there's no penalty for you. You have done what you're required to do. But let's say you offer coverage to everyone, but you just don't make it affordable for everyone. Then the penalty is a per person penalty. So it would be $3,000 annually for each person that is not offered affordable coverage that goes to the exchange and gets a subsidy. So maybe you decide, hey, I have a bunch of higher income employees. I'm going to provide benefits to all of them, but I don't want to base my employee contribution just on a few low income employees. And so I'm going to run the risk of them going to the exchange because I don't think they're going to do it. And so maybe you run that risk and one of them does and you pay a $3,000 penalty and that's cheaper than providing the benefits. Maybe that's what works for you. Or a more likely scenario is you were asking me about an older employee. Where this gets really confusing are those of you that are over 50 employees but you are on a small group plan. Because how you're going to figure out affordability when we've got like 19 rating areas and 44 ages and all of this stuff is a bit crazy. So maybe you do have a couple of employees that are maybe in their 60s, and so a plan for them on an age-rated plan is really expensive. And so maybe you talk to them and you talk to them and you say, hey, I'm not trying to leave you out in the cold, but I actually think it's going to be better for all of us. If you go on the exchange and you get a subsidy, it's going to be cheaper for you, and then I'm only paying the $3,000 penalty. Can I help you figure this all out? I mean, that may be a valid choice. So there may be some reasons why you choose to do the penalties, but so far in our experience, the whole pay or play and everyone's dropping coverage, we're not really seeing that. So that's the penalties. And again, you don't pay a penalty if you offer affordable coverage. If they choose not to take it, that's on them. All right, taxes and fees. So there's 3 basic taxes and fees. We're telling you, everybody, they should look at 4 to 5% in taxes and fees this year is really, and what you're looking at, there's 3 different ones. So there's this Patient-Centered Outcomes Research Institute, PCORI. This needed to be paid by insurance companies and for fully insured and self-funded plans. These were paid in July. So if you were fully insured, your carrier paid this for you, but of course it's in your rates somewhere. And if you're self-insured, you had to pay this on your own. So this already kicked in. It was $1 per member per year. This year it goes up to $202 per member per year thereafter, and it only stays in place for 7 years. And what this is going to do is fund a nonprofit independent institute who's going to study claims, study what works, what doesn't work, and start giving some recommendations on that. The next is the Transitional Reinsurance Program, and what this is that they are having insurers all take money and put it basically in a bucket for other insurers that are taking on the high-risk population because they figure that's really who's going to get on the exchanges in the first couple of years. And so this is based on, I don't even know how they came up with the formula, but basically this year the insurance companies are paying $63 per member per year towards this. Next year that goes to $42. It goes down each year. This includes COBRA members, so this is going to be also something that you see pass through to you on your renewal, but it is tax deductible, so it's just going to be built right into your rates. So it is tax deductible, and these are fees paid to the Department of Health and Human Services in November of every year, and applies to fully insured and self-insured employers. So this is something that you're also going to see. And then finally, there's an insurer fee. This is actually only paid by fully insured, on fully insured plans. So this is one if you're self-insured, you get out of this one. And this is fees on earned premiums in the individual small and large group market to fund premium subsidies and Medicaid expansion. So this is also a cost on the insurer based on their overall market share. So this is also one that's going to be kind of, it's not tax deductible though. So it may be a separate line item on your premium or your renewal. And I do have to say that I'm going to again tell you that every carrier is doing these differently. So this is one of the things that each of the carriers are kind of doing them differently, but you should really look at 4 to 5% in taxes and fees. These are all paid by the carriers but trickle down to you. So if you're fully insured, you don't have to do the paperwork, but you're paying it somewhere. All right, so FSAs, HRAs, HSAs. So these are all pretty much have remained unchanged. HSAs are sticking around. There's now a $2,500 limit on FSAs that kicked in last year. Standalone HRAs do not meet the Affordable Care Act requirements. So basically, if you have an HRA where you just give your employees, oh, here's $5,000 through a tax-advantaged account, you can use that to buy individual premiums or turn in claims. Those no longer meet the mandates, so you can still do that, but you're also going to pay the penalty on top of that. So those are not allowed. But HRAs that are tied to a health plan, where there's a big deductible at the beginning and the employer funds both some of it, and then when they hit the top, it goes to the health plan, those are still allowed. There's also something called a premium reimbursement arrangement where you used to be able to, through your flex plan, allow people, it wasn't really Section 125, but they did it through your flex plan, you could allow employees to run individual premiums tax-free through your flex plan. There was a bulletin that came out last week from one of the big flex providers saying they were no longer going to allow this. I have not seen an actual IRS brief on this, but I kind of believe the bulletin that we got that that's going to go away. Basically, they don't want to make it easy for you as an employer to give employees cash to go get their own health plan versus you providing a plan. So that's really the trend that you should kind of expect. If you are under 50 right now, you can still do standalone HRAs, but we have found, and this came up with San Francisco, some of the TPAs are saying that is not our interpretation, we're not going to allow you to do that. And then some of our TPAs are saying, no, the IRS is not saying we can't do those, they're just saying it doesn't meet the ACA requirements. All right, grandfathered. Let's say you held on to your grandfather plan because you thought it was going to you were going to get out of some of the mandates. That really pretty much, there's not much value in the grandfathered plan at this point. As of this year, you still have the 60-day maximum waiting period. You don't get to avoid that. You can't have the lifetime limits on coverage. You can't have the rescissions of coverage. The one thing that you had last year if you were a grandfathered plan is that you could avoid having young adults on your plan if they had a plan elsewhere, if they had coverage elsewhere at their own employer. That has now also gone away. So if you have an employee that has a kid up to the age of 26, they can put them on your plan. So there really isn't much value in having stayed grandfathered. If you just did because it was easy, that's fine, but if you did it, if you kept taking on more expense because you didn't want to touch your employee contribution because you were concerned about the grandfathering thing, I'm not sure that I think there's any value in continuing that this year. Regulations that aren't finalized. There were some non-discrimination rules, and we've talked about this at previous seminars. The non-discrimination rules under the healthcare reform law were going to be much tighter than under current law. And the way they were written, they weren't going to let you break employees out by class anymore. They were going to say you need to offer all the same benefits to everybody. They have retracted that, and the IRS has actually used the word indefinitely. So I don't believe that we're going to see this year. I think we are going to get some more regulations about when you can break employees out by class and how you can do that. But I don't think it's going to be soon. Could be wrong, but I don't think so. But if you are an employer that you have different benefits for different groups of people, You can still do that this year, but I wouldn't have like different rates for each employee and different options available per employee. I'd really try to make sure it's objective as possible, that you do it kind of per group or class that really makes sense and you can defend it. Because anytime we see a group where they have kind of different rates and plans for everybody, whether or not you intended to be discriminatory in any way, if you put that on an Excel spreadsheet, I will find you discrimination, be it on gender, age, national origin, any of that kind of stuff. So you can still break employees out by class and have different benefits for different classes, but really make sure that that is defensible, and know in the back of your mind that they might tighten up what you're allowed to do here. So that's just kind of out there. There was also this idea of automatic enrollment. It was going to be for employers of 200 or more. You were going to have to automatically enroll employees in a plan unless they opted out. So you'd have to fill out a piece of paper to get out of the plan versus to get into it, which is going to be just an HR nightmare. They have also, a lot of my lawyers were saying this is kicking in 2014. I don't know we're going to see this either. We haven't even seen proposed regulations. So, and how this stuff works is they come out with proposed regulations, then they wait for comment for 60, 120 days, they go back to the drawing board, they come back like 6 months later with final regs. So I don't think anything big like this you're going to see tomorrow. I think you're going to have at least a year's warning based on how the process has worked so far. All right, so putting together a strategy. So what do I want you to do with all of this? If you are a small employer, you need to know your plans are changing because the insurance company is being forced to change. You are not necessarily being forced to change almost anything that you do as a small employer, but know that the market, all of the other half of us that are large employers, it's changing for us. And so if we want to be competitive, we may want to match some of this. But it's really up to you to decide what's going to work for your company. So right now, what I want you to do is not wait till this time next year. If you think this is really going to change your business significantly, start thinking about it now, because a lot of these aren't just HR decisions. If you're going to decide, make big changes to your eligibility or how many hours it takes to get benefits, you're going to need to pull in your management team on that. So when you're looking about a strategy, you're going to look at things like your eligibility. What is your waiting period? Are you going to have to change it? Is significant? Is the concept of a variable hour employee, is that significant for your organization? If it's not, you don't need a policy on it. But if it is, there's some math to be done to figure out, do you want a 3-month wait, a 6-month wait, maybe you want a 12-month wait. The potential for auto enrollment for 200 or more employee groups, just know it's out there. Employer contribution, does your plan meet your affordability under the law? 2, is it practically affordable? And if it's not, are you not meeting your minimum participation requirements? Do you have a lot of people that aren't in the plan? And again, this year, probably a lot of those employees will be clueless, but next year they're going to be pretty irritated once they get that penalty. And of course, anything that's a problem for your employees is eventually a problem for you. So, do you want to be looking at all of that? And discrimination issues. Do you have different contributions for different groups? Are you thinking that's starting to make you a little nervous that maybe it's looking discriminatory? And then your overall compensation package. Maybe if you're a firm that you don't have a professional compensation manager, so your benefits are kind of one thing and your comp is the other. These benefits are only going to get more expensive, and so maybe this is the year to start looking at it as a whole package. And I do have to say, if you're thinking that you need to make a big change, this is the year. If you want to change something, just blame healthcare reform. Some other things to look at. Your plan design. Are you meeting minimum essential benefits? Most of you in this room are. You may have a really cheap base plan that might be going away. Do you want to add that base plan option? If you are on an age-banded plan, but you're a large employer and you completely cannot figure out how to do your contribution strategy, you might want to go to more of a fixed contribution. So you'd be looking at those kind of things. Maybe you want to look at self-insurance. Self-insurance products are really going down to much smaller employers, and there are some things that you can avoid. But if you're not a healthy population, I wouldn't look at that just to avoid a tax, but it might be a new option for you. Communication resources, what do you have? Do you want to be doing more? Do you want to do the minimum you have to do? Administrative systems. This reporting, when I talked about what the insurance companies were going to have to do with the IRS, employers, you're going to have to do something pretty similar. So if you're 75 employees and you're still doing HR on an Excel spreadsheet, your big goal this year might be an HRIS, a Human Resource Information System. I think most of you, to do your renewals, we're going to be saying, okay, what are the ages of all the kids? And you're going to be like, I don't know. I don't worry about that. It's a piece of paper in a folder. And so this might be the year. Your big budget item to ask for would be a real HR system. or a payroll system that has HR Lite, and anybody on the compliance team can give you some recommendations around that. And your budget. You know, trend is still 8 to 12% this year. So trend is actual medical expenses, how those costs are going up. On that, we're putting some taxes and fees. So most of you should have your accounting department prepared for a double-digit increase.